Welcome to the office.
Diana?
Yes.
How are you? Nice to meet you.
Nice to meet you.
So it's your turn now.
Yes.
And you're coming from Austin, Texas as well with your husband.
Mm-hmm.
Why are you here? Because I guess you were the motivating factor, right?
Yes.
He wanted to bring you first.
Yes.
For what?
For my nose, because I can't breathe through pretty much both sides. This is the most closed one, but when I get congested, this one gets congested. So this is the one that works.
The right side works, but the left side gets congested.
The left side works. The right side is the one that's almost completely closed. But when I get congested, the one that works gets congested, so I have to use the one that doesn't work.
Flip mode. Okay.
So I developed this habit of doing that. It like opens up my nostrils. So
how long you been doing that for?
I think
Couple years?
like, at least 10. My mom was the one who noticed that. She was like, why do you make that face? And I didn't know why.
So it's creating those dimple lines on her right side because of, you see that, right?
Yeah.
So the lines are a little bit different because she's been compensating using that right side a little more. Okay. And that's the number one reason.
That's the number one.
Because it's a breathing issue. It's not a cosmetic issue. Because it doesn't look, it looks fine from the outside. Okay.
No, it's a breathing. Every time I run or I do any type of exercise, I have to breathe through my mouth. And at night too, I develop a habit of opening. Now I close it with tape.
Make a lot of noise?
No,
we tape our mouths and we put the
dilators.
Oh,
wow.
That helps, but not enough.
Okay.
Yeah.
Well, that's going to be a good test to see if we can get rid of those things.
Hopefully.
Let's see. Okay.
Yeah.
All right. What else? Anything else?
I know my back is it's not straight.
Curved?
Yes, very curved,
Okay.
but it's never bothered me. That's something I'm lucky that I don't have any pain. I do notice that at night when I'm laying down to relax, I'll like stretch the left leg and it'll pop here and that feels good. And I think I do the other side. I'm not sure, but I know I do this one a lot.
Okay.
But that's not really because I'm feeling pain. I feel like I need to stretch that for some reason.
Correct. And this is a good case to, when we go over your x-rays, I'm going to explain it. Okay, so even though she has curvature in her spine, and when you guys look at the x-ray, oh my God, you have scoliosis. No, you don't. You got some curves in the spine. And I'm going to show you where they came from. But she has found her balance point, right? You're able to maintain your balance. You don't have pain from it.
No.
Okay, but here's the interesting thing.
Okay.
No, I'm not saying about pain. I'm saying you have compensated with that situation. I'm going to change that situation. So you need to retrain the body.
Okay.
You get what I'm saying? Okay, you've been doing all your workouts and activities based on this to keep your balance like this. I'll show you once we start to change the foundation, things will shift and you're going to have to find that new balance point. It's not hard, but it'll be different. Okay? Okay? All right.
Also, my feet, Daniel noticed that when I'm standing, my ankles will go in.
So bilateral pronation. Okay.
But my shoes, that's only when I'm standing, because I think when I'm walking, I do the opposite, because my shoes are always more used from this heel.
So when you don't have shoes, you're going on the inside.
Yes.
So this is going to be interesting, gait analysis. The question is she a pronator who's supinating to compensate, or is she a supinator who's pronating to compensate? We'll see it in the walk, okay? And it'll be kind of cool if it changes today. That'd be kind of cool. Okay. All right, anything else?
I think that's it.
Good start? You ready to get started?
Yes.
Let's go over your x-rays. This is your full spine x-ray. Okay. I'm going to switch them this way and this way. This is your 24-story building. This is your right side here and here. So in order to have a stable building, we need to have a level base and foundation. Okay. First thing is, do we have a level base and foundation? We're a little bit off. Okay. And yes, we have a little bit of curvature in the spine, and I'm going to explain where that comes from. And before I do that, I just want to check this curvature and see. And you have what we call a decompensated curve which means you can still get some changes, okay? If this line perfectly matches with the center of the dens there, then no, there's no change. But you're off a little bit is good news in this case.
Okay.
All right, and so let's go into the foundation first and let's work our way up. So when we're looking at the foundation, here's the interesting part. So number one, we have a little imbalance, 2 millimeter measure difference. It's not that significant to me right now, okay? But there's a little bit of the left side is a little bit lower.
Okay.
We have a rotated pelvis on that side with a slightly rotated sacrum, but the fact that the sacrum is tilted down on the left side, that's what's creating that kink. So again, this is also an old tailbone injury. And guys, I talk about so many tailbone injuries because nobody's addressing them. You know, when I see them as kids, and you see some of my kid videos where we get them under 9, dude, great things happen fast. So it's, you know, everyone's like, oh, he's always finding the tailbone. Yeah, because nobody else found it. Okay? All right, so the PIIN tells me you've had trauma. I know you've had slips, falls, whatever it was, okay? This is all before you, dude, so I'm letting you know. All right. This is all before you, dude. So, PIIN, the mechanics of the pelvis, the way the SI joint works. When you're looking at the SI joint, we call it an auricular surface. It has these little tongue-in grooves. It's not a perfect, smooth joint, right? And the shape of it will dictate how it moves. So when it goes AS up, it naturally goes AS. It wants to come in, IN. When it goes PI, posterior inferior, it naturally wants to go out. Yours went down and in, not down and out. So that tells me there was a trauma, whatever it was, because it went against the joint mechanics. Okay? So we have a PIIN on the side of a rotated sacrum that's dropped. 2 millimeter measure difference. I'm not so excited about that right now, okay? But whatever happened in the tailbone started this process, and then L5 tilts with it, and it starts that kink, right? Now, if we follow that kink up, it starts to level off in the middle of the back here. But then you see right there, it comes back to center, 12, 11, 10, 9. But then at 8, it goes off again. Excuse me, so T8 is a potential. 8 takes the whole thing off to the side. You see that? So T8 is an issue. Sacrum, left pelvis. That's where we're at so far. Now, interesting in her case versus yours is her Meganblasy, the air bubble, it's a great shape, but it's still a little smaller than it should be, and she also has that permeated moth undigested food appearance as well. Okay. So I'm going to suggest both of you take a little bit of HCl. Okay, you can share it while you're here. You can see the difference in a couple of meals. Okay. All right, big time.
And so what is that bubble?
So this is good question. This is normal. The Meganblasy is a German word. Okay. That means air bubble. The shape of this, it should be there, and it should be this big. So yours is about, I would say, 50 to 60% of what it should be. Okay. His is a lot smaller. Okay. But the fact that you still have all this undigested going through, I would still maybe add a little bit of HCl short term.
Another thing,
What?
I don't chew my food because I feel like I'm gonna pass out because I have to breathe through my mouth. So that might be.
So her breathing is causing digestive issues because she can't breathe through the nose.
So yeah, I've noticed that I speed through my meals because I want to breathe.
No bueno. No bueno.
Yeah.
Take your time, or he can chew it for you.
Mama bird.
Okay, does that make sense there?
Yeah.
All right. Deviated septum, yep, there it is. And yes, you got the double whammy too. Okay, so going back to the x-ray, and we're looking at the deviated septum. And you have 1, 2, you have both of them. The one up here is higher up, though, inside, way up top there, okay? And you said you're feeling it more on which side?
The right, so you can hear it too.
No, which one is worse? Your right side.
Yeah.
But when it gets bad, your left goes bad too, and then you're stuck on that right. Okay, All right. All right, well, let's see if we can remodel it for you. Okay, and we'll see if there's anything upper cervically related to that, okay?
Okay.
All right, so let's zoom out of here. Does this x-ray make sense?
Yes.
Okay, now the fun one. So let's look over here. And first thing we're going to look at is posture. And we can see same thing as you carry the upper part of your building behind the foundation. We're looking at the posture line. This line from the lowest lumbar should go back here. It should be back here, dude. Same thing. You're compensating very well for your situation. And I know when you guys don't exercise or are active, it doesn't feel good at all. I get it. Okay. Now, so that's posture. We got to figure out how to bring that all forward, right?
Okay.
Curvature. She doesn't actually have the right curve. I want to see a little more. She has a sway back. And so we want to see a little bit more curve in that low back. Mid back is fine. She's starting to develop the reverse curve in the neck. So we will give you the habit changes you need to do on your part. Okay? Looking at your tailbone. As before you, dude. Saying. So we see the tailbone, one nub here, S3. Same thing, similar, open coccyx in the back there, and S5. So we got to figure out this scenario first. Okay? From there, the discs are fine. These are curved because of the kink in the spine, but the discs are fine. Okay? The discs are fine. These discs are perfect. These are great, great, great. But digestion is an issue. You are starting to get calcification of the ALL on these little sides here. Start to see that. We need to talk about that HCL, and I think we should start on it. The neck, here's the interesting part in the neck. So we want to see a nice smooth curve. This is all posture because there's no disconnect in the posterior vertebral bodies. This should be contiguous with yours are. There's no break in what we call George's line, even though there's some imbalance. The facet joints are all good in through there, but you can see there's more weight being put on here. It's getting thicker. Wolf's Law bone will grow according to the demand placed on it. So C7 is where it's starting. 6, 5, 4, 3, 2. 7 and then 6. 5 levels out, 4 starts the reverse. You can see it opens in the back there. So we will need to probably start on the lower cervical spine. C7, T8, Coccyx, S3 to S5, somewhere in there. Those are the majors that I see right now.
Okay.
Any questions on this? You just came for a nose crack, huh? Yeah. Okay. You ready?
Yes.
Let's get started. Sit up straight. Okay, so let's take a look. Sir, you want to come back here? Come check it out. So you can actually see her curve, okay? You can actually see that on her. But she has maintained herself very well with that situation. And like she said, this is a great example. She don't have pain from a curve in her spine. So the x-ray isn't telling us, oh, you got pain, we got to do all this stuff to you. No. The x-ray, I just pointed out the imbalances that started from the foundation. We have to find nerve pressure on the patient, not on an x-ray. The x-ray then tells us how to correct it. Make a sense?
Yes.
Starting at the base of the neck. Isda ochito. Ocho. Ocho. 5 points. S4. You guys got similar stuff, dude. Who gave it to who? S4. T8. Head down just a little bit now. Good. C7. I heard Guadalajara's become like a big IT place now.
Oh, yeah.
Big, right? Big on
Yeah.
technology and all that. It's like the Bangalore of Mexico.
Yeah.
Have you been there before?
I have not. I've just been to Central America, El Salvador. I used to do missions in TJ back in the day with a bunch of chiros, and we helped an orphanage down there get into this beautiful, you know, those little huts with metal sheets on as their roof.
Oh, wow.
And now they got this beautiful, it looks like an Italian villa on the side of the mountain there. It's beautiful.
Wow.
And some families, patients of mine, used to go down there, and electricians and plumbers and this and that. And so we went down to do chiropractic to help them out. Okay. Head down, please, slowly. Static palpation, running my fingers down the spine. And as you can see, right there is where the edema starts, all that. So that pool's in there. It's not as bad up here. You can see all that there. And it goes right there. 1, 2, 3, 4, 5, 6, 7. Duele?
No. A little bit.
She's tough. She's tough. So another great example, if there's nerve pressure, do we want to, and there's no pain, do we want to adjust it? There's nerve pressure there, but there's no pain. Do we want to adjust it?
Yes. There's a little bit of pain. Oh, there. No, higher.
Right.
Right there.
S3. I'll be on the outside now. Come back slowly. Número 5.
The past one at the end, there was a little bit right there, but not like
Coccyx.
a little there, yeah.
Coccyx, S3. 8. Oh, I'm about to change our whole program. Sit back for me, please. Scoot your butt back. Thank you. I'm going to grab the hair a little bit.
Mm-hmm.
Nice and easy there. 7. To the right, to the left. And let's run the meter on the back and let's see what we find. Starting at the base, first thing we got was the base of the neck. 10 points, C7, right side. 8 points, C1, right side. Ochito! 8. Oh yeah, we did all this, that's right, but I just want to do it again just to make sure. All right, okay, static palpation, that's where we were at.
That was done too.
Cool. Head down, please. C7 to the right, we said.
Mm-hmm.
And now we're at C1. To the go on that side. Right side is fine.
Mm-hmm.
Come over in the front. And right side.
Oh.
Left atlas, C7 right, T8, coccyx, S3. Stand up, please, for me, dear. Let's see the walk. Move that over for me. Why don't you come over here first? Take your time. Thank you. I need like an auditorium, dude. Come back here. All right, let's see if she got that Guadalajara wiggle. Let's walk let's walk. Yes, you see that? It goes like this. We want to see her moving this way. Just keep walking, don't stop. You see it when she's walking, right? And the right foot externally rotates, the left foot pronates when she walks. Come stand behind me, please, so you can see. No, you keep walking. Okay? Keep going. Yeah, she got that little Guadalajara hip hustle. You got that little on that right. Don't think about it, just walk. And straight line, come on. Turn, straight line. Okay, now we can see what it is. Good. Have a seat back over here. Let's go over the game plan. There you go. All right, so here's our game plan, Diana, okay?
Okay.
We're going to start on the coccyx over here. We're going to go over here, do the sacrum and T8. We're going to come back over here, do C7, or check the neck and C7 and 1 or the other.
Okay.
After we do that, then we got to check the jaw and the nose.
Okay.
Okay, and then we'll work on the ankles.
Okay.
Let's go right side down. And I'm just going to have a little water. So you hadn't seen anybody for. You seen anyone for any of this?
No.
And then you just said, get on the plane, let's go to LA.
Yeah.
All right. You might as well get some shopping out of this.
Yeah.
Right? Sorry, bro. Slide up, slide forward. Bottom leg nice and straight. Bring the head back, please. Good. Hold the wrist here. Bottom leg straight. Top leg is bent. I got you the whole way. Try not to help me too much, okay? I got you the whole way. And for you, I will be on the outside here, okay? Right there. There. So we want to bring it out. Tuck forward a little bit more. There we go. A little bit more. That's it. Do-do-do-do-do. There it is. Bring it out and up. Whoo! That's a good little ass crack. Come on up. Walk it out once. And walk. Walk. Cool. Come over here. Let's go face down. Más arriba. Poquito más. Bueno. Bueno. Okay. Let's crank it up. Hold her. Light. Lifting out. That was a great miss. Out. There you go. Okay, lightly, please. Light. One more. Light. Now I'm on S3. Okay, you got her? And we want to bring that left side up. Oh, that's the home run. Great, that's all. T8. 2, 3, 4, 5, 6. T8 from the right side, reaching over. Gotcha. Buenasera. All right, let's walk it out. And as you're walking, you can tell us if anything feels different yet.
Yes.
Let me open the back of the gown. Let's see what's up with the Guadalajara wiggle. Walk it off.
It feels different, but I don't know how to explain it. This feels firmer.
Balance.
Yes. And I don't know about my legs or my hips.
They're moving through a little bit better.
Yeah.
Come on over.
Oh.
Simón. Simón. Simón, chica. Slow. Ochito clarísimo. Clarísimo. Claro. Now let's see what happened here. That cleared C7, but 1 is still there. Interesting. Are we seeing patterns, people? Are you seeing the patterns? Well, same thing. We got to do a little bit of 2 on her, just like yours. That's so interesting. Sit back para atrás. Para atrás. Back. Bueno. Número dos, poquito. This is just to get a better stable joint for C1. So this is light. Look up. No. Relax there. Relax there. Try not to help too much. Okay. Down. Don't help.
Oh, down what?
Oh! She likes to control, doesn't she? She's the control freak, huh? Wear these pants! I'm just messing with you. Wear these pants! That don't match! All righty, relax there for me. Up. Bueno. That's also one. Drop. No. Come on. You're helping too much.
Okay.
I'm going to have to do a little alternate. There you go.
I don't know how.
Walk it out once, come back. Actually, we'll walk more than once. Let's see the difference in the walk. Turn around. Walk. She's going through that joint a little bit better. Look at her feet. More stable. You do feel that, right? Walk on your toes, please. No heels tonight. Turn around, walk on your heels.
Just my heels?
Yep. One more time, regular walking. Let's make sure everything is clear. Come have a seat, and then we'll work on the nose and jaw. And foot. Doo-doo. Clarissimo. Clarissimo. Bueno. Hard part's over. Shoulders, I'm going to reach over, okay?
Okay.
Let me do the work. Left side. Ears. Let's check the jaw. Sit back. Open. Right deviates, left compensates. Open all the way. Close halfway. Hold. Pushing left to right.
Oh.
She holding that stuff in. That's that familial stuff. That's that family shit she holding in. You know what I'm talking about, right? Yeah, open. She got no issue giving orders, but open, close half.
What hurt? Oh, now this one
Yeah,
hurt.
I know. I'm just doing what I got to do.
Yeah.
All right, we got work to do on that. You got a lot of shit you need to let go of, dude, while you're here. Get over here. You're holding a lot of stuff, lady. It's all that family stuff on your back. Work is fine because she likes giving orders, right? So that part of your work is fine. You got to deal with the, you can't give it to the people, to the family. They don't listen, even if it's for their own good. So you mean right, but slide up. You're going to need to let go of some of that stuff. I'm just saying. Okay, chin down, slide down a tiny bit. Left. Oh, it's ready. Juicy, girl. It's juicy. Come and help. Hold her head here. Hold her so you're holding like this. There. Gotcha.
Oh.
Breathe in through the nose. And maxillary bone holding the right. Nice. That clumped. Breathe. Muchísimo. Bueno. Diferente.
Yes.
Sí.
Wow.
Okay. And you're going to walk.
Wow, that's different.
Good. Yeah, you got socked in the nose. Better be different. Keep walking. Steaming is really important, guys, okay? So even if when you get back, I like old school pot. But if you have steam room or whatever you got to do, get steam. Okay? If you got to go buy one of those little steamers from Target or something. Just at least while you're here, and then I'll advise you at the end, okay? Back over here. Qué bueno. Qué bueno. Just want to make sure nothing came out. She's all good there. Go on your back. I'll work on your ankles. I'm going to just start the ankle process. We'll go more on it next visit, okay? AS talus, medial tilt, posterior fibula. AS talus, medial tilt, posterior fibula. Stand up. Squeeze the hand. Squeeze.
Squeeze.
Squeeze. Face me this way. Squeeze. Squeeze. Not bad. Elbow. Lunate. Elbow. Lunate. Squeeze. Questions?
No.
Welcome to the office.
Thank you.
Bienvenidos a la mia oficina.